Good morning, everybody. It's Dr. Galvin with a very, very brief COVID update. All quiet on the Western Front. That's what I'm going to call this one because in my opposite of what we used to see before in my clinic, I've been seeing lots of our patients have been coming down with COVID. Generally mild symptoms. We've had to put a few people on Paxlovid, but they're getting it. A lot of them are immunized, so they're just not getting very sick, or they've had it before. In the hospital, we're really not seeing any. We admitted a couple COVID patients last night, but nowhere near, so we're seeing lots of kind of COVID in the community now, not so much in the hospital, because all these people who have been immunized just are not getting sick. And 70% of the population has been immunized, and many others have been infected. And like I told you, they both really confer pretty good protection against getting dangerously ill and needing to come into the hospital, but they don't prevent you from getting sick. And at some point, I wonder, where we kind of draw the line and say, hey, these current mutations are just a different coronavirus. I mean, we've had so many mutations since the original ones. At some point, we call it SARS-CoV-3, which I think is going to be a much more mild and sort of endemic infection. So that's what I say. That's good news that we're not really seeing tons of sick people. Again, the 3 people that we admitted last night, all of them were unimmunized. So immunization certainly does confer those benefits. I wonder at some point whether we're going to need boosters that just kind of are really designed for the variants. I think you have to be careful though, and you've got to sort of take those precautions. If you're going to be in an enclosed space with a lot of people, think about wearing that mask. My wife and daughter just were on a plane. I said, please, while you're on the plane, wear the mask. It definitely is going to protect you from getting exposed. These new variants are very, very contagious, and if you get exposed, you're going to get sick. Hopefully you won't get really, really sick, but you will get sick. And the worst thing is you potentially could give it to somebody else who might be vulnerable. So that's a very quick ER update. I'm Dr. Galvin, board-certified emergency medicine doctor, also functional medicine here in Charlotte. We are doing a series about the 5 pillars of health: nutrition, fitness, sleep, stress, hormones. I'm going to be shooting a video in the next day or so about fitness next. We just did one about nutrition, and we'll go through all those, and then we'll come back and we'll sort of take a deep dive into each one of those areas because they're really important if you want to stay healthy and live a long time. Have a great morning. I'm going to bed. Good night.